Congressman Kevin Brady is our guest, Republican of Texas. Thank you so much for being here this morning.
Thanks for having me.
Immigration is a big issue in your home state of Texas. So tell us about what you got out of the closed-door meeting yesterday with House Republicans. We're hearing reports and seeing the news saying that there's a real split in the caucus.
Can I tell you, I was here during the debates on when President Bush proposed it, and the discussion now is healthier than it's ever been. I mean, it really has been focused on, what are our priorities as a country in immigration policy? How do we have a smarter border security? What's our workforce need to look like for the 21st century? And how do we both train up American workers, and how do we fill the gaps best and most streamlined? And we're having a real discussion about, how do we deal with legal status for those who are here versus citizenship, government benefits, roles in the future. I'll tell you, it's night and day different. I think night and day better. And I think at the end of the day, you're going to see legislation out of the House. It's going to be different from the Senate, but that's okay. I mean, we actually, we're not big on the gang type approaches. We're 435 pretty independent people, but I think at the end of the day, we move a pretty thoughtful piece or pieces of legislation.
Is there a danger in Republicans getting bad press on this and not being able to pass something that's comprehensive enough that includes some sort of pathway to, you fill in the blank, which should the pathway even be?
I think we're resigned to getting bad press on immigration issues just because that's an easy narrative sort of to slap at us at, but I don't think it's accurate because the discussions we're having are very respectful. They're very good ideas. And you're seeing a lot of them from a lot of people. And again, this is a big issue, and it's sensitive. But I think at the end of the day, we come up with a better solution on the issue than what the Senate passed.
So should there be a pathway to citizenship or a pathway to legalization?
I think a pathway to legal status is where the House will likely go from the standpoint that citizenship reserved for those who come through the front door of legal immigration. Those who overstayed their visas or chose another path, a legal status will be, my guess, the answer without a pathway to citizenship or government benefits. And that reflects not two classes of citizens, but sort of two sets of behaviors in which we think, rewarding those who, well, the front door is a tough front door. It's expensive, it's lengthy, it's difficult. And so that needs to be fixed as well, by the way.
Let's look at your district, the 8th District of Texas. In terms of population, it's got about a 19.7% Hispanic Latino population, much smaller than Texas overall, which has nearly 40% Hispanic population, although it's sort of in line with the U.S., which is at about 17%. How do your demographics influence your vote?
One of the areas we have, because we're outside the Houston region and then going north into rural areas, we have a blend of minority constituents, but our Hispanic growth has really been among entrepreneurs, a lot of small business. Our Hispanic Chambers of Commerce really are very dynamic folks, and they have the same issues every small business person has, every entrepreneur has. We have a number of schools in the newer part of my district that has minority populations with all the challenges that go with that. But Texas, I'll tell you, is very welcoming and very diversified. We're just so focused on economic freedom as a state, and welcome everyone who wants to be part of it. I just have a great district from that standpoint.
We saw some stories in the news and talked about one earlier that said Republicans should be concerned about the White House and what happens in 2016 and future Senate races, because the way the districts are set up, you might be able to retain House seats, but there is a concern among some Republican strategists that it's not a winning strategy for the White House and the overall party. What do you think?
I think we need to have a discussion with all minorities. As speaking as a Republican, I think we've got a better opportunity for them. I think we have a better vision for them. Right now, we're having trouble even having a conversation because of some of these issues. So I don't think we can pander to Hispanics, to African Americans, to Asian Americans. It just will get out-pandered. But we ought to have a discussion, and one of the ways to do that is find a good solution, a sound solution, a principled solution on immigration.
Are Republicans listening to voices outside of Congress? We saw the former President George W. Bush speak yesterday in Dallas and encourage some type of movement forward. Who are you listening to?
Yes. One, I think most are listening to their constituents clearly, because this is not a new issue. You know, our families have made decisions on this. They feel strongly about it. It helps, I think, to have former President Bush weigh in, because he really, led in this issue and really took a lot of, slings and arrows in that process. But I also think we're listening to our small businesses, our technology community, those who just can't find workers, who are leaving economic growth on the table as well. So.
In terms of economic growth, we saw the Wall Street Journal editorial page look at House Republicans and immigration and express some concerns about the direction House Republicans are going. It says a GOP choice, a party of opportunity or closed borders. And it says House Speaker John Boehner's job is to make sure that Republicans who don't want to see some sort of component of a pathway to citizenship and are only arguing for secure the border don't win out. It says history proves without question that the best way to reduce illegal immigration is by opening more paths for legal immigrants to meet U.S. labor demands. Talk about the economic
No, I actually think we are that party of opportunity. And what you're seeing in the discussions we're having is not just a close the border discussion, but a security first, so we don't repeat this problem in the future. As you know, the CBO estimates the Senate bill fails in that, only lessening illegal immigration by 1/3 to 1/2. That's a pretty poor result for a pretty comprehensive piece of legislation. So security first, so we don't repeat the problem. That workforce issue, we really think is key, both in the low-skilled and the high-skilled. The question is, do you determine the workforce out of Washington, or do you give the free market a bigger say in that, a more flexible say for guest workers and visas? I think the answer is the free market. So I hope the public gives Republicans a chance, not based on the old stereotype, but really on the discussions we're having now.
If you'd like to talk with Congressman Kevin Brady, Republican of Texas, here are the numbers. Democrats, 202-585-3880. Republicans, 202-585-3881. Our independent callers, 202-585-3882. Before we go to the phones, let's turn our attention to the federal health care law. You held a hearing yesterday. This was a part of the Ways and Means Committee. You're chairman of the Health Subcommittee, and you were looking at this employer mandate that's been pushed back. What's your perspective on it?
Yeah, bottom line is, Affordable Care Act isn't ready for businesses, but it's not ready for families either. And we believe out of fairness, because the two are such pillars of the overall law and so closely tied, that really if you're going to delay one for a year, you ought to at least delay the other, because you really can't enact that mandate on workers without the mandate on businesses. And we're also concerned that because we won't be reporting, we won't be getting the important information from businesses about their plans and who's really eligible, you've really opened up both taxpayers to fraud, but also people applying. If you don't get it right, you face both repaying those subsidies, which is really tough on your paycheck, pocketbook, or facing some pretty stiff fines. So it just makes sense, we think, to move them both back. And we also are bringing Treasury in next Wednesday, because this was a very strangely timed announcement for a major pillar of this health care law. We want to know what led up to it. Where from here? What other parts of this law are the deadlines being missed? Because so far, almost no major element has been reached on time, as scheduled, and we're just a few months out of the October 1 exchanges.
One of your colleagues at yesterday's hearing, Representative Bill Pascrell, Democrat of New Jersey, weighed in with his criticisms of how the Republicans are handling this. Let's take a listen and then get you to respond.
Thanks.
Is this perfect? There is not a piece of legislation that ever came through this body that was perfect. So we need change. You cannot deny that Obamacare, we'll use your term, is helping millions of Americans. You want chapter and verse? I'll give it to you. You cannot deny that most employers offer health insurance even without a mandate, and small businesses will be exempt. You have no ideas on health reform yourself. In fact, those you put before the Congress, your own party rejected. So you can't have it both ways. More important, it's better to be right than fast.
Congressman Brady, your response.
Love Bill Pascrell. He's wrong on 2 counts. One is that the employer mandate is critical. In fact, in this same committee, when we offered reform suggestions that didn't have a mandate, we were told, you know, we were gutting Obamacare, that this was critical to the whole law. Today, the new narrative, oh, it really doesn't matter. And everyone's got health insurance anyway, which was not the whole basis of this push for health care reform. The second one is Republicans do have ideas. I think good solutions. The only one that actually lowered health care costs, unfortunately, we never got a chance, not one vote, not one opportunity to just debate another solution to it. I think that's one of the reasons we're so frustrated, not just with the bill, this massive, unworkable bill at this point, but I still think the American public ought to have a choice.
Let's hear from our callers. Roger's up from Bedford, Ohio, Democrats line. Welcome.
Hi there. What I wanted to ask the man that you have there is why that when black folks came into this country, we were brought over here to build this country, okay? We didn't have no visa or anything else, but all of a sudden now the Puerto Ricans or immigrants or whatever that are coming into this country now that want to come in here, they have to have this, they have to have that. This is y'all's doing, because like I said, we did not ask to come over here. We were forced to come over here, okay? That's the way that was. So why all of a sudden now is it so bad when other people are trying to get into this country? They built this country for white folks, okay? When they built this country for white folks, but y'all want to stop that. And something else about the health care. The health care bill, okay, that's supposed to go through. Ask California about it. Ask them how it is working in California right now, since you guys have such a problem with it. And
okay,
why did
Roger, let's get a response from Congressman Kevin Brady.
You know, I'm proud of the role Republicans played in ending slavery in America. It was one of the darkest times in our nation. But it's not really relevant to this issue in the sense that we are a nation of immigrants, but those who've come through the front door of legal immigration. And what we want to do is welcome those, you know, who are both pursuing their dream and wanting to contribute to America. And one of the big questions about our policy as a country is, do we welcome you because you have a family member here, or is there a priority because you have a skill, a contribution you can make to make our economy stronger, to make America stronger? I think the priority ought to be on those skills, especially these days we're competing against economies throughout the world, and we ought to be recruiting and welcoming from throughout the world. So that's a key issue, and you know that's a pretty healthy discussion to be having.
Henderson, Nevada. Don is a Republican. Welcome.
Good morning.
Morning.
I'm dead set against it. As an immigrant, a veteran, and lifelong resident now of the United States, I'm dead set against making something that's illegal. Number one, we don't even know how many illegals there are in this country. They said 11 million estimated. It's probably closer to 22 million. This administration is upside down. We need jobs for our own citizens in this country, not for illegals. And if you travel the Southwest, you'll see that a lot of jobs are taken up by illegals. We need to enforce the laws that we have on the books, and then as a government, be selective as to who we admit and in proportion like they did when I came to this country.
You know, I think there's agreement on the importance of securing the border, and in a really smart way that you measure it. I think that's critical, unless we want to look up in 10 years and have the exact same, or 15 years, have the exact same problem we have today. So I don't think there's disagreement there. It's how we do that. And on the job standpoint, clearly we have 21 million people who can't find a full-time job today, yet there's still jobs that are going unfilled. And why? Because the skills either don't match the jobs, especially in the high-tech side of it. I'll tell you, in construction, hospitality, number of low-skilled workers, we don't have Americans stepping up and taking those jobs. Many of them are good-paying jobs. And so my thought is, A, let's train up Americans we have here today, including making commitment on the high-tech side as well. But secondly, let's have a guest worker program that fills in the gaps, because as a nation, we're not repopulating at the rate we need. We are going to need workers over time. There's no question about that. The question is how we fill them. And I think there's a smart way to do that.
On Twitter, Voter One Vote tweets in and talks about the health care law.
Yeah.
She says, do Republicans still discuss the Affordable Care Act being overturned? And she says, Medicare was altered by President Bush. Aren't changes to laws common?
Well, they are, especially laws this big. There's sort of been a bunker mentality, which is don't change any aspect of it. This bill, I think by every admission, was poorly written, and it really wasn't designed to go into law in this form. So far, we've seen major portions. The Class Act was essentially unworkable and abandoned. The 1099 reporting, both parties said that makes no sense and repealed it. The small business exchanges, which were a big promise in this, were delayed a full year. They're just not ready to go. Now we see that there's two pillars of this, the mandate on families and the mandate on companies. One's been delayed, which again I think leads to, out of fairness in coordination, we think pushing back the other as well. I would still like to see the opportunity to offer a real alternative, because in this next year, I think the White House is in disarray. I think they're in a rush to get this in place. I think they're going to do it poorly.
Chris Eliza writes in the Dana Milbank in the Washington Post, same area of the paper but different author, in his Washington Sketch column, says that the unqualified opposition by Republicans over the health care law is the unqualified opposition is counterproductive for House Republicans. And he says, you think that the opposition party, which has spent 4 years denouncing the health care reforms, would be delighted by this reprieve. So can you have it both ways?
Businesses didn't ask for a one-year reprieve. They asked for the employer mandate to be repealed. What they got was a politically convenient one-year reprieve, but as we heard in the hearing yesterday, the problems are still there. Businesses are still cutting hours in workers' paychecks. Some of them are not hiring as a result of this. So much uncertainty, as we heard from a small business person yesterday. He's been opening a franchise and a half every year for a decade. It's stopped because he doesn't know how to handle the new health care costs. He doesn't know how to go forward. We're seeing that across the economy. And so I actually think, again, having a thoughtful discussion on how we ought to make health care more affordable and pointing out that there's some real flaws in this bill, that's healthy as well.
Congressman Kevin Brady represents Texas' 8th District. He serves on the Joint Economic Committee, where he's a chairman and deputy whip. Also, Ways and Means Committee, where he serves as chairman of the Health Subcommittee. Also sits on other subcommittees as part of Ways and Means. Let's go to Brian in Fitchburg, Massachusetts, independent caller. Hi, Brian.
Yeah, how you doing?
Welcome.
Yeah. When all these congressmen grew up, they didn't have free trade with China, where it's killing us. All the jobs are getting shipped out. If you're not in college, you're I don't understand why they're doing that. Then now they're letting all these legals in, so that you can't even, the little bit of jobs that are left, the illegals are taken.
Well, let me just, the first point on trade. Look, when I was growing up, America has always been competing around the world to sell our products. And what we found that is we're very open. You can go to any mall, you can go to any store and find products from around the world. So our families have low-price choices, high-price choices. But when we try to compete around the world, we often find American need not apply signs. I think the trade agreements we put in place, I think about 14 of them with countries that say, look, two-way trade. If you can sell in the United States, we sell into your countries, into your customers, have worked spectacularly. We are able to compete now with more affordable energy, able to compete throughout the world. We're seeing manufacturing here in America compete again, affordable energy, and the most productive workers on the planet able to compete. I worry about those isolationists who try to build walls around America, think that will make us stronger. It won't.
Gray, Georgia. Amy is a Democrat. Hi, Amy.
Good morning.
Morning.
I just have a comment and a question. My comment is that Texas is, full of millions of people who lack health care. There's huge inequality with wages, low-wage jobs. At best, if Texas were a country, it would be something like Brazil, basically third world.
Okay, you'll probably get a fight on that one.
Let me finish. Republicans have gone from being a loyal opposition to being very close to being traitors. You will undermine this country to score political points. The debt ceiling debacle, all those things have harmed our country. And you say you're doing it because you're the loyal opposition, but really you have such a hysterical hate for this president that you're willing to basically drown us in the bathtub to score political points.
Let's let the congressman respond.
I disagree with almost every word that you said, and I know you meant it sincerely, but the truth of the matter is we really do believe this country is headed in the wrong direction. We think the debt that's been piled up really is a drag on our economy. This is the worst recovery in 70 years, and a lot of families are paying the price for that. Wall Street's doing great. Joe's six-pack, not so great. We think solutions like the health care law are the wrong solutions because they don't make health care more affordable. They just shift who pays for it. And we're already seeing doctors, 600 doctors in Texas, can't afford to see our seniors in Medicare right now. Many won't see Medicaid. And I'll point out, because Texas has a lot of immigrants, we have a lot of poor communities. You're right. We have a lot of people without health care. But after this law is in effect, we'll still have millions of people without health care. In fact, across the country, 30 million families won't have health care in their household, even after the president's law is put in place. So what I do see, though, in states like ours, and you see this in many states these days, the economy has improved significantly. We're holding the line on taxes. We're seeing job creation. We just love to see that across more of America. I think our economy, I think our future could be much brighter than what it is today.
Congressman Brady is chairman of the Joint Economic Committee. We saw the Federal Reserve Chairman Ben Bernanke make comments yesterday. He says the economy still needs Fed stimulus. Front page of USA Today. He notes inflation is still too high and inflation too low, and he says both sides of our mandate are saying we need to be more accommodative. This is from the money section.
Yeah, we're addicted to stimulus from the Fed right now. Here we are, 4 years after the recession ended, 4 years in recovery. Wall Street panics over every interpretation of Chairman Bernanke's estimate of where we go forward and when we start to taper off and withdraw. The market rallies when the job numbers are weak because they believe the Fed will keep stimulating the economy. Those are not healthy signs. We ought to be much stronger, much more stable, much more sustainable at this point. So I actually think the Fed is creating more uncertainty, going forward, and you can tell the global markets roiling for 2 or 3 days based on the comments you're making. We've got to get back to fundamentals.
Palm Springs, California. Owen, Republican. Go ahead.
Yeah, I had something to say from one of the first gentlemen who called about, the race issue. First of all, in the Constitution or the Declaration, one of the two, all men are created equal, and that's what they said at the beginning of this country. I mean, it just so happens that, we had a civil war, and now, everybody's the same now, We were all created equal from the beginning of this country, so that was a misunderstanding on his part probably. But second of all, I had a broken heel bone, and this is before they even had this thing in there. I went to the emergency room. What happened to me was they couldn't even give me a bag of ice. What they did is they gave me a runaround for 3 hours, and then they said you had to get a cast somewhere else. Well, I was looking for some, financial help because I couldn't work. I had a busted heel bone.
Yeah.
And then what happened was I went to the where I get public services, and I asked them, if I could get services because I wouldn't be working with a broken heel bone. I couldn't. They told me to buzz off. Basically, I couldn't get it because my wife works, and still we were having tough times. And then they're out front. The illegal immigrants are out front. They have enough money for ice cream cones because the ice cream man comes over there. Then when you get back here, they got, and this is in California, they got jobs out here where they're
I'm sorry, we're running a little low on time, so I just want to take us back to something the Congressman can respond to. So you talked about both your medical issue and not, so how did you deal with your medical issue?
No. This part was about the immigration. They're operating machineries like leaf blowers and lawnmowers, and they can't speak English, and you need to tell them, hey, you need to stop your machine. They can't understand you.
Okay, so Owen bringing up the question of jobs, American jobs, and also what he's seeing is sort of a hypocritical situation as he tries to seek medical care.
Yeah, it's frustrating. I don't know the whole situation on the healthcare area, but obviously the ER is for emergency visits. One of our biggest problems has been it's been the front door for healthcare for too many Americans for non-emergency reasons, and the rest of America pays for that very expensive care. That's why I think a lot of work has been done to create community clinics, federally qualified healthcare clinics, which really treat people like him very cost-effective manner. You have to provide some money based on your income, but it is extremely affordable. Keeps people on health care. It's actually one of the better, excuse me, I think one of the better bangs for our buck in health care are these clinics and centers. I frankly would like to see more of them because it really keeps folks out of the ER. It increases in those communities healthy babies. You have working families who can't afford health care who actually can get affordable health care. We thought that was one of the alternatives as well. It's massive health care law. I'd like to see us sort of head that direction.
We have a Texan on the line. Jonathan is and Brian on our independent callers line. Hi, Jonathan.
Hey, how you doing? Being that I'm a Mexican-American, I just wanted to talk about the immigration and things like that. What I want to say is that being that illegal stands in America, as long as legal's here, we're going to have immigrants, regardless. Security, what do we have to worry about security for? This is America. What are you talking about? September 11 happened. Security, we got deep on security. And what I want to say is that, as long as legal stands, that immigration is going to be here. So the thing is, fixing the problem is, I feel like it's not a problem. Fixing it, getting it done with, and that's it. We have bigger problems on our hands. The gentleman stated some racist comments that I didn't take offense to, but, it pretty much got to me, if you want to say, about the leaf blowers and things like that. A lot of Americans tend to not put themselves in other people's shoes. You got to understand, hey, people have families. People have babies. They're trying to raise these kids to be as bright as they can be. Because sometimes, what we got to understand is that, people work every day. People sacrifice time. People sacrifice everything they got. And why? It's because their kids' future.
Okay, Jonathan, let's get a response from Congressman Brady.
Well, when I used to represent Brian in College Station in Congress in my first 3 terms, it's a great community that Jonathan lives in. Frankly, I'm misrepresenting them. I'll just say, I actually think America is the most compassionate country in the world. One of the key questions is, how do we help families? Is it to the government? Do you send your money to Washington? Do we up here take your money, siphon off a big part of it for overhead, and choose where those dollars go? Or are we applying these solutions and this compassion locally, where you actually have a big impact, a big say in it through, your local charitable organizations, your churches, the programs you set up? I actually think our most effective solutions are occurring at the local level in Bryan College Station, in Aggie Land, where Jonathan is at. I'd like to see truth matters. We look now these days to Washington for the solution for all answers, and we ought to be looking more toward our communities, our small businesses, our charitable organizations.
Congressman Kevin Brady, I'm sorry that's all we have time for this morning. Republican of Texas, represents the 8th District. Thanks so much for coming in.
Thanks, Libby. Appreciate it.